about your heart health is critically important, and uncovering the biggest risk factors for your heart and what daily habits can help protect your heart can really be lifesavers.
Yeah, you have to pay attention to this. Hartford Healthcare Heart and Vascular Institute taking action to prevent future heart issues. And joining us today, Dr. Adam Harblett at the Hartford Healthcare Heart and Vascular Institute. Dr. Harblett, first of all, thank you so much for your time today. Great to have you on this morning.
Thank you for having me.
It's great to see you. Let's talk about the biggest risk factors for heart issues such as heart attacks.
Absolutely. So the major risk factors for cardiovascular disease are the ones your primary care physicians have probably already harped on quite a bit. High blood pressure, high cholesterol, having diabetes, smoking, or having elevated stress in your life. There are some not so common, not well known risk factors, which include family history, as well as poor sleep.
Doctor, let me ask you about the age when people are at greatest risk for heart disease. I would think it would be kind of in middle age when people had a great deal of stress in your life, like you just talked about. Am I off the mark there, or correct?
Absolutely. So traditionally, we found cardiovascular disease to present itself older than 50 and typically in males. However, now the new focus is to start screening people for the risk factors we spoke of earlier, as well as identifying these people earlier.
All right, well, you talk about screening. Of course, that's something that people can do. We want something more that we can do in our everyday lives. What are some of these good practices for daily positive heart health?
Good heart health daily activities pretty much start with your morning diet. We should be focusing on a low cholesterol diet, the one that the AHA and ACC pushes, the Mediterranean diet, as well as getting mobile, getting active. Exercising at least 30 minutes a day is really helpful, not only for stress levels, but also for your overall cardiovascular health. And of course, avoiding things like alcohol and smoking.
Doctor, what does Hartford Healthcare Heart and Vascular Institute do to help prevent people from having future heart issues when they come in?
So, of course, Hartford Healthcare Heart and Vascular Institute is focusing on the traditional major risk factors: high cholesterol, smoking, diabetes. Additionally, we're using the latest technologies and a personalized approach to identify those higher risk individuals. Things like coronary calcium scoring, in which we can do a low dose CAT scan and identify coronary disease before anybody knows about it on a typical diagnostic test like a stress test.
All right, Dr. Adam Harblett, this impacts so many people, and you've shared a lot of great advice with us today. Thank you so much for joining us.
Thank you again.